Hi, and welcome to the show. Subscribe at kevinmd.com/podcast to get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Marita McCahill. She's the founder of Practice Grow, a healthcare growth strategy consulting firm. And today's KevinMD article is titled Practice Permanently Closed: How to Avoid This Costly Mistake. Marita, welcome to the show.
Thank you.
So, we'll talk about your article in a little bit, but first off, let's briefly share your story and journey.
So a little bit about me is I started out in management consulting and doing some marketing in that area. And then as things evolved, I just have a bunch of friends and family in the healthcare industry, particularly physicians. And they used to come to me and ask me some questions about marketing. And I realized as a niche, healthcare providers really don't know a lot about how to market themselves and why it's important and for their own brand and for their own practice growth. So I started specializing in that area and it really just kind of took off from there.
So, tell me the type of practices that you work with.
Primarily small to mid-size providers. So it could be orthopedic groups, it could be primary care groups. Primarily, they're independently owned,
Sure.
but I also have worked with chiropractic practices and then some for-profit healthcare providers that are separate from hospitals. So I have a variety of clients, but really what I kind of started seeing was individual practitioners, when you go through, say, med school, don't get any training on the business side of medicine.
Mm.
And as I worked with different clients, I saw how this lack of education really came back and hurt providers later on in their careers. And that's kind of where I came up with this. I developed a course for providers, a CME course that teaches you the importance of your own branding, personal branding, and also how to grow your practice, but grow it strategically where you get the patient, your ideal patient. So you're not just attracting any patient, but the ones you really want to serve.
So you mentioned that sometimes that lack of business knowledge has come back and hurt physicians later on in their career. So what would be an example or a story of that?
Okay. So, and this is covered in the article, but a really great example is a surgical oncologist who was in practice 20 some years, was a hospital based physician, and during the pandemic decided to change where he practiced and moved an hour away to work for a different provider, a different hospital system. And when that happened, his previous provider essentially online marked him as permanently closed. And so his patients, when they would Google him, couldn't find him.
Hmm.
And when they called the old practice, they were told, he's gone and we're sorry. Would you like to see someone else? When you look at it from the patient's perspective, if you are in the middle of treatment or you have a valued relationship with your provider, particularly a surgical oncologist, you want to be able to follow that
Right.
doctor. And so what was happening is patients couldn't find him. He was just down the road an hour. And because he didn't own his online presence, he couldn't communicate to his patients where he went. And so essentially he lost a lot of patients and very far into his career had to start all over again in a different market. And had he managed his brand himself and owned his online presence, he could have seamlessly communicated to patients via, online basically, where he went and how they could get a hold of him. So that was a really costly mistake. And with the rate that providers are changing practices these days, I mean, for one reason or the other, people move where they're practicing. And that's fine, but you at least need to be able to safeguard your own brand and future proof where you go throughout your career. So that's some of the practices that I teach in my course and I try to educate providers on.
So you talk more about this particular story in your KevinMD article,
Mhm.
Practice Permanently Closed, How to Avoid This Costly Mistake. So in this story, was this a Google listing that surgical oncologist just didn't own themselves?
It was all of the listings.
Oh.
So it was your WebMD listing, Google listing, Vitals listing, everywhere. And even just having your own website. I try to educate providers on, if it doesn't matter if you're hospital based or in private practice, there is a value to having your own website. And it doesn't have to be a extensive website, but it's just a nice way that you can personally connect and share your story with patients. And then say you move, you can just always very easily update your contact information via your own website.
Now, specifically with that surgical oncologist Google listing, was it owned by his prior employer and
Yes.
he couldn't get it back himself?
Actually, that's something I did for him. So I was able to get it back, but it's much more complicated um, to do it that way. And there's ways for providers to own their own Google business listing and share it simultaneously with their employer. So if they don't want to manage it while they're in practice, they don't have to, but it will safeguard you in the long run if you own it. And so there's joint ownership opportunities there, or you can own it yourself. So that's what I try to teach people as well.
So in 2024, what is the best way that a physician can own their own brand online, short of hiring a consultant? Is this something they can do themselves?
Yeah, they can, or alternatively, if they have some people have a child or who's pretty tech savvy, or a partner who's tech savvy, yeah, you could do this yourself. It's not super complicated. It does take a little bit of upfront work. And yeah, I definitely advise providers do this. And I don't think it requires especially an individual practitioner. If you're a practice, I would recommend, yeah, you should hire this out. But if you're an individual practitioner just wanting to safeguard your personal brand, yeah, you could do this yourself. You just need to kind of know the steps to do it. And honestly, that is what I cover in the course. Step by step, this is how you set up your online listings. Here's how to have a website, the bare bones. And really, that is where I'm different in that I'm not selling necessarily consulting services. I want to educate providers on understanding what they need to do for themselves, and then they can make the decision to either do it themselves or hire it out, because both options are available. But I feel like a lot of providers, you're so heads down in your practice that probably managing your online presence isn't something you want to do, but you definitely could.
So I'm going to assume today that even independent providers are probably going to have their own website in this day and age.
A
In
lot
terms,
don't.
a lot don't really. Is that
A
true?
lot do not. As an individual practitioner, like if you're part of a practice, they'll have a page on their practice's website. But I have found, I mean, the majority of my clients that I've worked with don't have their own website, which is, I mean, for them as an individual practitioner outside of, like, say if they're in a hospital system. No, most of them don't. And
So
like that's been my experience.
So, in terms of starting a web page, any
Yeah.
specific tools that you would recommend? There's so many options out there, and I think it's
Oh, there
overwhelming
is.
for a lot of
Yeah.
clinicians. So, if you could distill it into what you think is the highest yield, easiest way for an individual clinician to create a website, what would you recommend?
I would recommend there are so many templates out there. Just buy a template and personalize it with the bare bones of what you want patients to know about you. And again, I covered this in the course, but some very high level things would be, who is your ideal patient and why do you want to treat them? And getting that personal connection with patients online. So when they do Google you, you can stand out a bit, because people want to connect with providers on a personal level a bit. And I feel like a lot of times, if you just have a institutional site that says, this is where I got my med degree, this is my areas of specialization, my fellowship training, that's great. And people want to see that. They also kind of want to understand that backstory of, why did you go into medicine and why did you choose this specialty? And frankly, why should I choose you over someone else in the hospital system or in that practice or in the community? So I recommend using the website as a way to not only build your brand, but to connect with patients and draw them into you and differentiate what you do. And I don't think it has to be a very technical site. It could be a very basic site with some nice pictures and just talking about you and just making sure you're easily found online when someone were to Google you.
So when I was talking about online reputation all those years ago, I always encouraged the use of social media as an easy way, almost a surrogate for websites in addition to a website, of course, because some clinicians would find creating a website individually to be too much in terms of the friction that's involved. So today, what's your take in terms of social media to build a clinician brand?
I think social media is a great way to connect, but it can also be overwhelming. I think there's so many channels now. It's Facebook, Instagram, Twitter. I mean, there's just so much. I feel like building just having a very simple website so people can Google you actually is a little easier now. And again, I have another study that shows that how patients find doctors or find their healthcare providers outside of, it could be a nurse practitioner, is when they do a Google search, one of the things they look for is your reviews, first and foremost. Second, they want recommendations from friends and family. And then third, recommendations from other healthcare providers, so referrals. So those three channels are the most direct way to attract new patients, reviews, word of mouth, and referrals. And that's what the data supports, those three channels. So if you're going to invest in those three channels, less so in social media. I think people look at the provider's social media, but that's not how you attract more patients. So I always encourage providers to really invest in their reviews, whether that be health grades, whether that be Google. And there's a lot of tools out there that can really help practices grow fast in terms of review management. But that's my take on social media. It's nice, but it's not so much the first and foremost right now.
So I see a lot of tools when it comes to review management in terms of
Mhm.
making it easier for patients to leave a Google review, for instance. So
Mhm.
what do you think about those third-party options?
I think they're great. I think they can really streamline the process. There's a number of them out there. The ones I'm familiar with are pretty slick, and they can also extend beyond just the review system. They can help you with doing targeted ads. I mean, there are some very sophisticated tools out there that I believe really do just exponentially grow your online presence, and they're worthwhile investigating and considering. So yeah, I think they're great. And in terms of like review responses, that's again, I cover this in the course. Like that's a really important part of understanding. You can't just review, like acknowledge patients in the reviews. There's very specific HIPAA protocols,
Hmm.
and those tools that help you with review management, they're all HIPAA compliant. So it's just another way to safeguard your practice is to, invest in one of these tools, and then they give you very specific responses that are all HIPAA compliant. You can just select one that's appropriate for the review, and then your practice is safeguarded. I don't know if I would necessarily recommend one of those tools for an individual practitioner, but for a practice of a couple providers, for sure, I think they're great.
And to be clear, when you say that physicians should start a web page, the majority of clinicians today are employed by large hospital systems, for
Mhm.
instance. So you recommend that in addition to their practice page, that they get an individual page just for themselves. Is that correct?
Yes, that is exactly what I would recommend. And again, it's to future-proof their practice. You just don't know where life's gonna take you. You and your family might decide, "Hey, I wanna move cross country," or, "Hey, I wanna move, an hour away from where I'm currently practicing," for one reason or the other. And if you have your own web page, you can seamlessly communicate to your patients where you've moved. Similarly, if you own your online presence, you can take your patient reviews with you when you move. So you're not starting from ground zero after being in practice 10 years. So, yeah, those are some of the key recommendations.
We're talking to Marita McCahill. She's the founder of Practice Grow, a healthcare growth strategy consulting firm. Today's KevinMD article is Practice Permanently Close: How to Avoid This Costly Mistake. Marita, tell us a success story where you saw a clinician take an interest in their online brand and it really moved the needle for them in terms of growing their practice.
Sure. Actually, I have a pretty in-depth case study on my website if anyone wants to download it. But I worked with an orthopedic surgeon who owned his online presence, and he was able to move practices within the community. He had 200 and some five-star reviews.
Okay.
And when he changed practices, because he owned his online presence, it was, you know, an hour of work to go on all these sites and change your phone number, your office details. It was a pretty seamless process because he had set up, or we had set up everything to manage himself. So when he left one group and actually so this was an example of a provider who left a group and went to a hospital system. And so he was able to keep all of his reviews when he left, and patients were able to find him very simply. Oh, he moved across town and he's at a
Mm.
different practice. So he did not lose barely any of his patients. So it was a great success story in that aspect.
And my final question will end with some of your take home messages to the Kevin MD audience.
I think the number one thing I would say to providers is you don't get a lot of business training in medical school or in nursing school, and this is really a detriment to your practice. And it's pretty commonly known that doctors aren't typically business people as well. And that's really fair because you have a full-time practice, you're dedicated to treating patients. However, I wouldn't not learn a bit about how to take care of your personal brand, because it really does go back to your patients and patient care. And if you want patients to find you and you want to have a thriving practice, you need to know the bare minimum of how to market yourself and to attract patients. So business training really does help you in the long term. And that's honestly why I created this CME course, because I know bare bones what needs to happen for providers to keep and retain patients. And it doesn't have to be that complicated. So really my takeaway is you can do it individually. You don't have to hire it out. And if you are interested in doing it individually, you just need to educate yourself and, invest in yourself.
Marita, thank you so much for sharing your perspective and insight, and thanks for coming on the show.
Thanks. Appreciate it.